We are now moving on, very linked topic with a panel discussion. And just to kick off discussion, I want to start with very few, very high-level slides, which I just put together for us to start the conversation. And then myself and Fungai will introduce our fantastic panelists, and we'll go with a round of few questions, and we'll look forward to your comments as well. And the questions from you equally are welcome. So COVID and women, and this is just a very interesting diagram. I'm happy for you to look in detail at it later on. That's from the Stroke Journal, looking specifically at clinicians and researchers, women in the area of stroke. But I found it to be very relevant to pretty much every subspecialty of researchers and clinicians. And there is no question that there was disproportional increase in occupational and family responsibilities among women professionals. And if you look here, the domains gradually shrink down, and I will not spend all the time around them, but look at the four big domains where we start is time, people, money, and space. But then if you look close to the woman figure, in the middle of this figure, you see that it comes down to mental, physical, and emotional capacity and reserves and balances that you have to maintain. And this is translated through multiple layers within this figure that include anything from the academic promotion to the responsibilities in regard of new marriage, having children, particularly for young early career faculty and researchers, where this frequently is a time when you coincide not only with your professional and clinical obligations, but also with the start of your own families, many times caring for the elder in the family at the same time. Next slide. And just to highlight some of the early papers that we start seeing the data, on the left, you see the proportion of physicians who are responsible for childcare, schooling during the pandemic, recent analysis from JAMA. And you can see huge disproportion between mothers or women's role in terms of care of children and fathers. And on the right, I thought was very interesting paper I found that compared the authorship as being first author, female versus male, in COVID-related publication and others on multiple publishing platform analysis across multiple disciplines. And you can see that in quite few areas and platforms of the wider use actually here, there were much more man lead and first authorship of the papers. Next slide, please. And just to finish up, because we are not narrowing our discussion only to the clinicians and researchers, we also have voices of women living with HIV. And we do know there is so much more to this equation and equality of women in terms of the pay, in terms of gender, sexual and physical violence, gender-based violence. You can see on the left figure, 243 million women and girls 15 to 49 years were subject already in a previous 12 months, and we actually estimate this number has gotten higher. We see big disproportional gaps in the paid work for women and men in the figure on the left. And actually on the right lower corner, you see that in gender pay gap is huge and remains very big. But on the right lower corner of the slide, you see actually unpaid work by women within the households. And I was truly stunned to see this being on average 4 hours a day. That is not even meant to be paid. It's just a woman's work that needs to be balanced with her professional responsibilities. So with that, let me transition us to our wonderful panel. I will start by introducing the first two panelists, and then we'll pass to Fungai. I'd like to start by introducing Sahir Dirajal Fargo. I'm very pleased to introduce Sahir, who has been our fellow a while ago at a Children's Hospital in Washington, D.C., but now has taken on a beautiful career as a clinician and a clinical researcher. She's a physician and a faculty at Case Western Reserve University School of Medicine and Rainbow Babies and Children's Hospital. And she combines both clinician who delivers services role together with a researcher with a focus on cardiometabolic complications of HIV and ART in children and adolescents. And then the second person I will introduce is also a long-term friend and dear sister of mine, may I say so, Judith, is Judith Kosa, is a doctor from Elizabeth Glaser Pediatric AIDS Foundation. She's Associate Director of Pediatric and Adolescent Services, is involved with multiple global bodies like GAP and many other initiatives, and really can reflect on the programmatic implementation and the challenges faced by the physicians in resource-limited settings. Judith lives in Kenya, but travels all over the continent extensively, including some travel even during the pandemic time. And now passing into you, Fungai, to introduce two other panelists.
Thank you, Natella. It is my utter delight to introduce Dr. Charu Kaushik, who is tenured fully a professor in the Department of Medicine at McMaster University, Hamilton in Canada. I was reading her bio and it is very extensive, very impressive. And in the past 20 years at this university, she's done a lot of teaching and training and built an interdisciplinary research program. With such an extensive bio, it is no surprise that Charu has received many national and international awards for the work that she has done. Thank you for joining us, Charu. And last but not least, I've got the pleasure of introducing my friend and sister, my sister friend, Longret Kwadem. Longret is a co-director of the 4M Network of Mentor Mothers, CIC, and Salamander Trust Associate here in the UK. She's a peer researcher, public speaker, and an active community advocate who belongs to several networks that are covering sort of the UK CAB and SWIFT. Longret's passions are in meaningful involvement of people living with HIV and looking at sustainable funding for grassroots levels to ensure that nobody in the HIV response, especially women and girls, are left behind.
Thank you, Funkai. Thank you all for your time. It's been really a pleasure to have you assembled at this one important conversation. Let me start with the first question. I'd like to ask Charu to take a first take of it. What were the biggest challenges in your professional, and if you want to share your personal life as well, that were COVID related, and maybe some just insight on the major mechanism of how you even approach challenging them and challenging the challenges or coping with them? Charu.
Yeah, thanks very much, Natella and Fungai. So good morning, good afternoon, good evening, everyone. Just to start off, apart from being a HIV researcher who works in women's reproductive health, so I look at biological factors that make women more susceptible to HIV and STIs. And in that role, I have a large laboratory with different levels of trainees and postdocs, and we were running a clinical trial. We were just getting ready to run a phase 1 clinical trial before the COVID pandemic took over. But in addition to that, here in Canada, I play a dual role where I'm also the scientific director for the Canadian Institutes of Health Research Infection and Immunity Institute. And in that capacity, I have a small team of about 8 or 9, mostly women. And we provide the scientific and strategic lead for investing funds and providing directions and guidance to the Canadian government on where investments need to go in the infection and immunity area. So no surprise, the COVID file, of course, landed in the middle of our portfolio. In that context, the workload for the team, III team, so the Institute of Infection and Immunity, I'll call them III for short, our workload went from probably every person working about 40 to 45 hours to about 70 hours a week, because we were providing guidance for how to deal with COVID. And in the last 2.5 years, the research money that's been spent by CIHR on COVID-related investments is about $300 million over 226 different initiatives. And my team and I spent time on shaping at least 17 of those. So you can imagine the kind of work and hours that takes to do that kind of work. So, when you said, Natella, you were showing the slide on emotional, physical, and mental, I think all of those are check, check, check. But, I think that's true for everyone. But just in terms of physical time, I'm still attending about 10 to 12 hours of meeting every day, and I spend 4 hours in the evening answering emails and approving briefing notes and everything. So in the context of COVID, my research, which is supposed to be at least 25% of my time, just got pushed aside. And basically, I was spending about 70 hours a week just working on the COVID-related work. And I saw that around me for everyone who was in the HIV area, that they were switching over and focusing on COVID research. So that's one aspect. The physical, mental, and emotional well-being of my teams. That was the uncertainty that's there at every level. And especially as a leader, your role is to provide assurance and leadership to your team. But when you're yourself dealing with, there's no way for me to say, well, let's not do this work because we are sort of the point people to do this work. So having to deal with that burden that falls on the entire team, and how to devise methods to keep them motivated and focused on the work despite the physical, mental, and the anxiety that came with it. Very challenging. So my favorite line, through the last 2 years has been, let's not think about thriving. Let's just think about surviving, because nobody has encountered, a pandemic in our lifetimes before. I hope we don't have to do it again. At this point, let's just keep the boat steady and do what we need to do and just prioritize. So probably the biggest challenge, and of course at home, I'm a mother. I have 2 kids who are, one's 17, one's 21. So having both kids shut down at home, sort of young adults who are pacing around and, sort of wanting to do other things. So I think we've all faced that challenge, and the anxiety of having parents and parents-in-law who are older. The first year was terrifying, in terms of dealing with their health. So I don't think I'm saying something that, not all of you can't identify, but just that, we play many roles in our lives, and all of those sort of come together. And I hope that we never have to live through these kind of times ever again.
Thank you, Charu. Thank you very much. Senior career stage, older children, very, very insightful comments in terms of surviving and shifting the focus and time management. Let me move to somebody who is in earlier career stage, Sahira, and has younger kids at home, school age, but also is a clinician and trying to build clinical career at the same time. Sahira, would you like to share some insights as well?
Yeah, I echo Charu. I really hope we don't have to live through these times again. I think prioritizing cannot be, underestimated. And I think that's how I decided from the very beginning in terms of how I would cope with this, both professionally and personally. So professionally, as you mentioned, Natella, I'm a pediatric infectious disease physician. So it's not like I could just not come to work, right? The pandemic was affecting us directly. We were the experts. Fortunately, the first couple waves of the pandemic really didn't affect children as much. But, for us, as it is for the adult counterparts, it's really almost each wave has 3 components. So the acute COVID, the multi-system inflammatory disease, so MIS-C in the US, PIMS in the UK, and then long COVID, which we're actually seeing quite a high percentage of our adolescent and youth presenting with. So it's not over with just, the acute hospitalization. So personally and professionally, it really came with prioritizing and dividing and conquering. So, one of my colleagues took ownership of just, antiviral and antibody, which changed by the minute. 1 minute they worked and the other we had data that they didn't, which with this new Omicron wave, we're kind of limited with what we're using. And then another took over MIS-C, myself and a colleague, both clinically and from a research standpoint, and then another focused on long COVID. It was impossible to do it all, and we just divided and conquered. And then personally, I just decided to prioritize the emotional and mental well-being of my children, which at the beginning, everyone understood, but a year into the pandemic, everyone had moved on. And then I felt like parents of young children were just stuck still with schools being closed and, activities being closed, and they weren't vaccinated. So I have a 6-year-old and now 10-year-old. But when this started, I had a 4-year-old and an 8-year-old. And so this was really challenging. And I was the mother where you could hear the children in the background. I clearly remember being with top CEOs at the hospital discussing our plan of care. And my child was playing like Kung Fu Panda. And the CEO said, whoever has the ninja, he's really cute, but can you please go on mute? And I couldn't go on mute because I was the one, responsible for presenting. So I just decided to put some of my research on the back burner, unfortunately, and focus on their emotional and mental well-being, which I will say in the long term maybe we should do more of that. And that's one lesson that I've learned. And then professionally surrounding myself with people who, you know, as Charu mentioned, could lift me up and really assist me in moving my career along. So some things definitely took pause for 2 years and others just couldn't. So prioritizing is the lesson I learned.
I do think in academic milieu, there's been a movement to try to allow women in particular to offset the career path and the time clock for promotions and academic growth, given that what you just described, you had to prioritize your children over continue pushing the career milestones. Thank you, Sahir, very much. Judish, any insights from you? And then moving to pass the word to Fungai. So she has, I know, very specific questions she wants also to ask Margaret. So Judish, please.
Yeah, thanks. Hello, everyone. And I want to really just agree with what has been said by the previous panelists. I think what we know as an attempt at work-life balance was totally thrown into disarray by COVID. And for me, who is a mother of 4 children, you know, I really faced that. So I had 2 groups of children. My older son was just starting internship. There was no transport to, you know, his workplace. He's at home. We have to provide it. And that was a challenge. While my other kids were back from school, studying at home, all of us sharing the same study space, you know, and dealing with stresses and other things and not being able to see friends. So I think that was what you speak about was a challenge. So it doesn't really matter what age your children are at. You know, once you're a mom, you know, you're the primary caregiver, then, you know, all these things will affect how you work. And indeed, it affected when I could go on meetings or, you know, being available on the computer or wanting to mute, like you said, Sahira, you know, you're speaking and somebody wants a pencil, for example, or to go and get water, you know, something as simple as that. So I agree, our lives were really thrown into disarray. And just like you, I chose to prioritize my children. And so I was lucky because the way I work with many people from other countries and the US. And so I'm busier in the evenings. So what I do is I wake up early, attend to the children, be busy in the morning with their work. And when it's 3 p.m., then now I switch back and I'm able to attend meetings with other colleagues. So it just meant I stretched myself. And I think like many colleagues, we may have had some burnout, but really it's just a matter of adapting and coping well. So that's on the personal front. But on the professional front, I think, and like Natella mentioned, I had a mini survey from some of my colleagues who live in resource-limited settings, who are clinicians and researchers. And one of the things that really challenges they had was the fear of getting COVID and bringing it home, because, you know, you go to the clinic every day and you're coming back home. And that was really a real fear. And some facilities had the ability to allow them to work for 2 weeks, stay in a hotel or a hostel, and then, you know, clean up, do a test and come back home. Some mothers told us they could no longer hug their children, or they would tell the children, you know, mommy has germs, you know, you can't do this. And so those were really fear, and it gave a lot of people stress. Many of them had, developed gastritis because of that. But I think apart from that, there was also just the burnout of working excessively. We had absolutely too many Zoom meetings, you know, going all out and attending all of them. So that really affected many colleagues, including myself. And I think the way we managed it was realizing after some time that this can't go on. You know, you can do less Zoom meetings. You don't have to be on video because it's pressure to be on video. So just managing and choosing to put yourself first, you know, and adapting to what can really helped. I think the other element that I gathered from colleagues, and for us, you know, our clinics were closed. We could not access our patients. We could not continue with gathering research data. And one of the things we did was virtual monitoring of research sites. It was an expensive affair. For example, $1 would get you 1 GB, and 1 GB would go for 2 to 3 hours reviewing data. So that is something that we adopted to. It took up some money, but at least we were able to adapt and reach clinics, do a lot of virtual case management. I think, Laura, you spoke earlier around virtual, you know, resources. So those are some of the things we adapted, and I think we continue to improve moving forward. Thank you.
Thank you all, and I will be passing now to Fungai. So she asked Margaret you a question, but I do want to say I heard one time a really great expression in recent years, which I think so much reflects to what you're saying. I heard an expression that work never walked to our households to that degree as it did this time. Plus, we're all reporting the household changed. And I can tell you on one hand, I felt very blessed to see my 23-year-old home a lot, but I don't think he shared my sentiments at all the time. And so dealing with the emotional status, I was clinging on him and he was like, please let me go out. So I think there's a lot of emotions we had to ride through along with that really actual physical presence of work, much more at your kitchen table, at your side of your bed, at your child's crib. It was everywhere. Funkai, let me pass to you so you can ask and engage with Longret on that topic.
Thank you, everyone. I think you've just sort of pushed me back to the stage when I had my 2 children in the house and also trying to prioritize what was good. I just wanted to bring the discussion to Longret because I hear that within the 4M network, you mobilized very, very quickly. Laura was talking about isolation, mainly for women living with HIV. How did you ensure that, I mean, you can add your personal experiences that other panelists have done, but how did you ensure that women living with HIV that were more prone to be isolated were engaged in a fun, interactive, and safe way? Can you share anything that you did?
Thank you, Fungai. I think a lot of what's been said resonated with me in terms of my experience as well. And for me, working in a professional capacity, I am a co-director of Mental Mothers Network. We're a grassroots organization. We're led by women living with HIV, and we've been running since 2017. And because we were trying to manage a lack of funding, we started using digital systems since 2017. And so we run a WhatsApp group that is connecting all the women that we have trained as mental mothers, supporting other women living with HIV through their pregnancy journey and beyond. And so the advantage we had was we already had an existing community of women who were connected using WhatsApp. And so when the COVID started, obviously it was quite challenging for a lot of people. And a lot of the challenges that women faced ran across different varied sort of circumstances. But what we did was we tried to fundraise to be able to then support these women receive the support for mental well-being mainly, and general peer support. So we got lucky that we received funding from the National Lottery, and it was a creative type of funding in the sense that it was helping us to think about the future post-COVID. And so that was really good because creativity is part of what we do anyway as an organization. And so it was something we had done previously that had been very well valued by the women that we support. And so this was quite specific to the COVID period. And that was helpful because it provided that safe space, which we always had anyway, but then it provided an additional space for people to process their emotions because COVID just crept up on us and people were kind of really stressed out about it. But that space, because we had a professional who trained us in photography and we were able to use the photography to take, you had a picture, you were given a camera, we provided data bundles because digital access, as great as it was also a major challenge that caused a lot of poverty and stress for people because women had to prioritize between providing digital data for their kids who were being homeschooled or then having digital data for themselves to access their own support online. But also not everybody has the ability to be able to manage data, digital equipment. So we had to do some support around, first of all, getting the data bundles, getting the phones, giving people some sort of skill building around accessing digital equipment, but also being aware that, violence was a main issue for a lot of women and a lot of people that are living with HIV had people who they were living with who were not aware of their HIV status. And so digital access, as great as it is, can also be a risk factor for violence for some people. And it could also be a way of excluding people from accessing support, because you need to have the privacy and the confidentiality to be able to access support where you are, but then you also need the skills and you also need the equipment. So we're able to do that. And actually, that was one of the best things that happened for us in that period, because then we had monthly sessions, people would drop in and we would have those write-ups, and we would write out our feelings and we would share them if we wanted to share. And then we're able to then use that medium to think about our future, but in a positive way. So that got us thinking really ahead. So we imagined the future, and we have we developed a manifesto. So that is what the future that we want to have post-COVID. And we've got it on our website. So if people want to, I could share the link so you can see that. But we also wrote advocacy briefs around breastfeeding. We wrote about COVID and pregnancy, what the issues were that women faced as well. So we do have quite a number of resources on our website if you want to have a look to see what we do.
Thank you so much, Longret. Natella, I'll go back to you for your next question, if we still have time.
We do have time. Yeah, we have about 15 minutes still. So I wanted actually to reverse the table. And we talked so much about challenges, and just to read the comment by Sharon, and it's echoed by Claudia Cortez, saying, I have never asked to review more manuscripts at any time in my career. I think the men had more time to write, which further widens the gender gap. And as I showed you some data on the public platforms for analysis of publications echoes this, I agree with you. It almost felt like the weight of it has pushed a lot of women. I am on the promotion committee. I can tell there is a lot of discussion going on about adjusting criteria to allow, particularly for young faculty and mid-level faculty position in academia, to adjust their career trajectory, in particular for women, because we recognize what all you described, the sense of isolation that Longret cited, having 2 young kids that need to attend schooling on Zoom. At least I feel the older kids kind of know a bit more what to do with themselves, though not at all the time. Probably they don't know more what to do with themselves in the evening, versus young kids can just be going to bed, and you need to assist them much more in the daytime. So there's a funny balance there, but there is no bad without good. And I think if we just keep this attitude in life to keep going, right? So my question, I just heard you, Longret, bring in the example of the good, of developing some really exciting materials, of developing some new way of communicating with women. So if I ask each one of you questions, starting backwards from Longret, what would be one biggest success to you, which you feel you achieved during the COVID time? What would you name it?
I think for us, it was the ability to carry on going. You know, I think if there was anything that the COVID showed us, it showed us that what we do matters, that we make a difference, because we were there with the people who were on the fringe of society because of the nature of the way that we work. So we are a really grassroots organization. So we have women that we train, and then we support them to support women within their communities. And so it was very easy for people to be able to keep in touch, because we use, again, the WhatsApp, the phones, and these people are people that they're already in touch with. And so for us, I think it kind of reinforced the idea that what the system that we're already using works. But again, the biggest challenge for us is funding, because what we do get is project-based funding. There was a lot of burnout. People go over and above to give their time, and these are women who are already stressed out. There was a lot of women who were having to go to work. Obviously, some women who live in the UK have no recourse to public funds, and so some people did not have support from the government. They had to be forced to go to work, but then they had children that were in school that needed that came back and needed homeschooling. So people were quite stretched, and so there was a lot of isolation, mental health stress. And then that translated into needing more service from us, and then translated into us getting quite busy and burnt out. So there was a lot of like a vicious circle. And I think that would be made easy if we could get long-term core funding sustainable funding for women's organizations, because we do the work. We're the ones who get down to the people who are not usually seen. But it's just really frustrating when we have to keep, going round and round in project-based funding. So it was great that we got COVID funding, but my thinking was, if there's funding for COVID, how come there's no funding for our priorities? So it was kind of ironic that all of a sudden there was money for COVID, but we've been saying these things and we've been doing this work. And I think it would be really good to get that support in a long-term sustainable way.
Thank you, Longra. Thank you very much. And I think you pointed out to success, but you still put the challenge attached to that. So, which is good to go forward. Judith, what was the biggest success for you?
I think the biggest success for me, Natella, apart from coming out alive, of course, is just the fact that we were adaptable. So for me, adaptability was a major success, both on the home front, managing all, the multiple roles I have, both on the professional front, managing the time, the demands, and moving forward. And actually, I published 2 papers during the COVID period. And also on the social front, being able to, find friends that I could gather with safely and, manage all the mental health issues. So for me, I think the key word would be adaptability on all the fronts. Thank you.
Thanks, Judith, very much. Sahira, what is your success story from COVID times?
Yeah, I think I'll echo what Longret and Judith said, being creative, adaptable, resourceful, also realizing that our expertise is unique. And there are other things that other people can help us do. So I don't have to be the lab tech, the research coordinator, the IRB coordinator, and the clinician. So understanding and surrounding yourself with people who can help you do these tasks while being creative. So I used to travel to sub-Saharan Africa every 3 months for my research, which didn't happen for 2 years. And so finding ways to be creative and continuing to move the research forward was really important. And then the last thing, which you mentioned, Natella, was also trying to make, the academic environment realize what it means to really ensure that women in academia can succeed, and promoting junior women and mid-level career women, and ensuring that, we continue to move forward despite the fact that, we may have not published 10 manuscripts like our male colleagues during the last 2 years. So I think those 2 things.
Very, very true. And I know of your advocacy. All of you have, interestingly, as I'm moving along, I'm passing the word now to Charu, along with your successes, you're all raising the advocacy for ongoing women's success, which you share with us. But none of you just said, this is what I've done well. It's truly remarkable. All of you are saying, this is what worked, this is what I think is good, but this is what needs to be done. So it's a really great perspective. Charu, if I ask you of the biggest success, what would be your answer?
Yeah, so I'll echo the others that, as we went through the 2.5 years, I was amazed at the resilience and the adaptability at every level, at home, in my community, my research team, my institute team. And even an organization like the Canadian Institutes of Health Research, where there are 700 people that are in program delivery and policy making, so as a leader who sits at the decision-making table, there's 4 out of about probably a couple of senior executives. So less than 20% of that senior leadership table is women. And it was interesting to see that at that table, it was always women who were bringing up issues around what women and parents are facing, the clear discrepancy between the experience of, as Sharon has noted, while some people saw this as an opportunity, got a lot of funding, were able to expedite their publications, their work, the people who were experiencing a completely different side. So it took a lot of advocacy at that table, but we did manage to make changes. We were able to advocate to increase time when early career investigators, instead of 5 years, to be considered for 7 years at this point. We may extend that further to change the timelines for that, change deadlines. We asked for and got flexibility for people to argue for submission of their grants that they could explain why they needed more time and have the agency provide that. One page in all the proposals to say how has COVID affected your work, so that the reviewers could actually look at that and take that into consideration. So we moved the needle on that in terms of policy making. But I was fortunate enough as a senior leader, because my funding is stable, and I hear Longret when she says, but because of that, I could provide stability to my research group. We just went into a whole pattern where we couldn't run our clinical trials, but I had 5 senior people, a study coordinator, 2 research nurses, a research scientist, and a lab technician who were sitting at home, and I just went into a whole pattern and just paid for their salary so they could have some stability. Supporting early career investigator who I'm mentoring to sort of say, you know what, don't worry about this. There's money in my grant. Let's just work on what you need to do. So being able to provide that support and use my resources to help people and help them deal with their anxieties, I think I did my best. So I think I'm pretty satisfied with that in terms of what I could provide to others.
So thank you very much. All of you mentioned sustaining the people around you. And it's amazing, both professionally and personally, and through advocacy and community. I will share with you that when I see the movies, cartoon of Superwoman, I always smile, because I think they create an image of somebody who tries to imitate to be a man. She's physically strong, she flies, she hits people around, where I think the woman who goes and cooks the supper after 10 hours of the Zoom call for her children is actually a superhero, because by the time you go to the kitchen and start cooking, your mind, your capacity to enjoy even the experience are quite challenged. And yet there are a lot of people at the household frequently who wait for this to happen. And I know all of us just turn around and put on different hats and put on smile and keep on going. So I want to express my very deep admiration to all of you. I know we have only a few minutes left. And if I just ask you all in the last closing 3 minutes, I will just pass on to maybe say, going forward beyond COVID, I also hope we will never face it again, but you never know. What would be main lesson in your life? What will you take? And let us try to be short. We only have 3 minutes. So literally, if it's one word, just say one word. Let me just go around, and I'll start with my co-chair this time. Fungai, what would be that?
I will now not be embarrassed to ask for help.
Okay. That's a great one. That's a great one. Sahir, I'm just going on my screen this time, not in any other order.
I would say shameless prioritizing. It's okay to have lunch with the kids if they're at home. It's all okay. I think giving ourselves permission.
Yes.
Or blocking the time on calendar so nobody can send you Zoom invitation for this half an hour. Okay, Judith.
I think I would say family matters comes first, and it's important to check on one another.
That's a very good message. And Longret?
I would say look after yourself, so self-care and knowing your limitations. So have a good balance.
Don't try to be a superwoman all the time. I don't hear. Charu, microphone.
Yeah, I would say probably flexibility, flexibility to accommodate what people are going through, flexibility to be understanding of other people's experience, to assure everybody that it's okay if you're not doing 150%. Like I said, my byline is now, let's just survive, not thrive. So as a leader, when you do that, it lowers everybody's stress level to say, it's okay. We can not be 150% for next 3 months, next 6 months. And I think that decreases a lot of anxiety on a lot of people.
Natella, I'll ask you the same question before you do the closing.
And I will say I'm perfectionist and I like to lead and I like to succeed. So for me, probably to accept that things will not be done exactly as I planned, to be able to accept I don't want to say maybe word of failure, but to accept that things are not achievable as much as I want in a certain time frame, and to actually probably stop and reassess what gives you the big joy. I mean, I think we're all entrapped in a very high performance. All of the women today on the panel, and as I'm closing it, Fungai, are very high performance. I mean, all of you have shown tremendous resilience, and I would say probably the biggest success. Look how beautiful you all look how well you all look, and how articulate and analytic you are in your answers, and how much heart and feelings you put behind your words. So I would say for me, it takes time to stop. I hope this session served this break in the meeting where we talk science, schistosomiasis, and God knows schistomatous, drugs, everything, HIV, and stop for a moment, think of yourself, cherish yourself, respect and celebrate what we were able to achieve despite many successes. We thank you all for attending the session today. I want to thank our panelists for very insightful stories. We are now moving to the guided poster tour. After a break, please do not forget to attend it. There are 3 tracks. They are listed here on the slide. They will have guided tour by people who know the posters already very well, and they will be generating a very meaningful discussion. So please take a short break and rejoin us at the poster session. We are very grateful for your time. Thank you.